Hello friends, I am Dr. Sandipaa. In my channel Homeopath, I will be discussing a subject regarding homeopathic practice. Today's subject is how to elucidate the mind aspect of each and every patient. So it is one of the biggest question in the students and in the practitioners, how to elucidate mind rubrics or mind symptoms. So initially I advise, or it is my experience, that mind symptoms should not be elucidated or it not be considered, simply because there will be an ambiguity regarding is it a proper symptom he is giving or just pretending. So it will be difficult to elucidate a mind symptom in any beginning practitioner. So I advise a beginning practitioner and a student to focus on PQRS, modalities, and there are other aspects wherein you can reach the totality. So that aspects we can discuss differently, but today I want to talk about mind symptoms, mind rubrics. So for a beginning practitioner and a student, the keen observation is lagging and he will be having so many thousands of thoughts in his mind whenever he gets a case before him. One is immaturity and another is lack of focus, leads the case in a different direction. So what is the key factor for eliciting mind rubric is you must have a silent mind. Mind is always chit-chatting, but I am telling that silent mind, that is consciousness. So if you are conscious of your own consciousness, then you are in a position to elucidate mind rubrics or mind symptoms, simply because you are not only aware of yourself, you will be aware of the surroundings, you will be aware of the totality of the picture whatever the patient is presenting before you. I mean to say, how he walks, how he sits, how he talks, what exactly his problem is, and where he is using phrases like I feel, I do, I think, I. Whenever I comes, this is the key factor for a homeopathic physician to take note of. He will be suffering from cancer and he will be smiling. So this itself can become a mind rubric, mind symptom, as if he does not have anything, he does not have anything. So he is feeling well-being in spite of very serious, dangerous disease. I am well. This is a mind symptom. The attitude towards the disease is mind symptom. So this is one aspect of mind symptoms. So if you look into his fears, if you look into his dreams, if you look into his sleep patterns, if you look into his desires, aversions, hobbies, habits, His total personality is vibrating in a different direction, which will give a identification note of his mind state. Whenever you come across a different personality with a different mind symptoms, his anger is triggered by few things, his fear is triggered by few things, his desires, his aversions, his oversensitivity, his hot and cold, his mind approach to his life, all these things put together will come to a very individualistic simillimum remedy what he is requiring. So, mind symptoms can be elicited by a physician or a beginning practitioner very consciously, and he must be very sure about whatever the patient is telling of. If not, there will be a confusion to come to the simillimum. So, initially, you must be very conscious of the surroundings, and you must be a good listener. For a good listener, it is very easy to elicit mind symptoms. To be a good listener, you must be having a calm mind or silent mind. So this is the first criteria to get the mind symptoms. So whatever I talked about how to take the mind symptoms, what he is expressing, what he is feeling, what his aversions, desires, his anger, his fears, his oversensitivity, his sleep, his dreams, his attitude towards life, his work, all these things put together will give an exact picture. We will be very astonished, or we will be very shocked how this has been designed by Dr. Honeyman so accurately. This personality tint of each individual patient is observed in our repertory in Materia Medica, and it is a very important thing to note those mind symptoms, and we can find the exact simillimum which can revert the total process of his disease, and he can be cured. So mind symptoms are very important. So I advise a beginning practitioner and homeopathic physicians to slowly gear up their understanding of mind, understanding of fears, understanding of anger in his patients, and take note of it properly, and exact words are being given in our repertory and in our Materia Medica. Exact words. There is no even if, but, is, was. No, it is exactly given what the patient is telling. That exact words must be phrased in a sentence, and you must go through the repertory and Materia Medica. So that will give you wonderful results in the curing process of each individual patient, friends. So this is all today, friends. If you like this video, please like, share and subscribe our channel. In future also I will be doing such videos. If you have any queries, please put in the comment section. I will be answering those queries. This is all today, friends. Thank you and take care.